Most men have been touching breasts completely wrong their entire lives. Gentlemen, let me ask you something. When's the last time you spent more than 2 minutes on her breasts before rushing to move on? If you're honest, probably never. Here's what most men don't understand. A woman's breasts aren't just something nice to look at. They're packed with thousands of nerve endings directly connected to the same pleasure centers in her brain that control arousal and orgasm. And when touched correctly, with patience and intention, her breasts can unlock levels of pleasure most women have never experienced, even with partners they've been with for decades. I'm Dr. Livia Moret, a urologist specializing in intimate health and sexual wellness for men over 50. Today, I'm walking you through 9 specific techniques that transform breast touch from a forgettable 30 seconds into an experience she'll be thinking about for days. Before we start, hit that like button, drop a comment telling me where you're watching from, and subscribe so you never miss expert guidance on becoming the lover she's always wanted. Let's dive in. Here's the brutal truth nobody's telling you. Most men treat breasts like a pit stop on the way to somewhere else. A quick squeeze, maybe a few seconds on the nipples, then immediately moving on, or worse, they grab aggressively, thinking more pressure equals more pleasure. Both approaches fail completely. Here's what's actually happening. A woman's breasts, particularly the nipples and the area around them, contain more sensory nerve endings per square inch than almost anywhere else on her body except her clitoris and vaginal opening. Research from the Journal of Sexual Medicine mapped the sensory pathways from breast stimulation and found that tactile input from the nipples activates the same region of the sensory cortex as genital stimulation, the same brain region. That means breast stimulation isn't just foreplay, it's a direct pathway to sexual arousal and, for some women, orgasm itself. Studies show that approximately 1 to 2% of women can orgasm from breast and nipple stimulation alone with no genital contact whatsoever. But far more women, around 60%, report that skilled breast touch significantly intensifies their overall arousal and makes their eventual orgasms stronger. The problem? Most men have never learned proper technique. They're guessing, copying what they've seen in movies, or just doing what feels good to their own bodies. A 59-year-old patient told me his wife had never really responded much when he touched her breasts. After 32 years of marriage, he assumed she just wasn't sensitive there. When I taught him the techniques I'm sharing today, he came back stunned. He said, "She gasped, Doc. She actually gasped. She told me nobody had ever touched her like that before." After 3 decades together, I just gave her a completely new experience. That's the power of proper technique. Today's 9 tips are ranked from foundational to advanced. Master each one in order, and you'll completely transform how she responds to your touch. Ready? Let's go. Tip number 1. Always start with permission. The first tip is simple but critical. Never assume, always ask. Before you touch her breasts, especially in a new relationship, or if you're trying something different, get clear, enthusiastic consent. This isn't about being awkward or killing the mood. It's about creating safety, and safety is the foundation of arousal for women. Try something simple. "I'd love to focus on your breasts tonight. Really take my time. Would you like that?" Or even simpler, "Can I touch you here?" Why does this matter so much? Because for many women, especially as they age, body insecurity around their breasts is incredibly common. They worry about sagging, size, asymmetry, all things that have zero impact on sensitivity but massive impact on her psychological comfort. When you ask permission and express genuine desire, you're telling her that you want to touch her body, that you find her attractive, exactly as she is. A study from Archives of Sexual Behavior found that women who felt their partners genuinely desired their bodies, regardless of age or appearance, reported 2.5 times higher sexual satisfaction than women who felt objectified or judged. One patient, married for 28 years, told me his wife had been avoiding breast touch for over a decade because of insecurity after breastfeeding and aging. When he started explicitly asking permission and expressing how much he loved her body, she opened up completely. Within weeks, breastplay became a central part of their intimacy again. Permission creates safety. Safety creates arousal. Tip number 2, warm your hands first. The second tip sounds obvious, but most men skip it. Warm your hands before touching her skin. Cold hands on warm, sensitive breast tissue is jarring. It triggers a defensive response instead of a pleasurable one. Rub your palms together briskly for 15 to 20 seconds before touching her, or run them under warm water. The goal is hands that feel comfortably warm against her skin. Why does temperature matter? Because the nerve endings in breast tissue are incredibly responsive to temperature changes. Sudden cold causes muscles to contract defensively. Gentle warmth encourages relaxation and increases blood flow. Think about when you get a professional massage. The therapist always warms their hands and the oil. It's not just courtesy, it's physiologically more effective. A 61-year-old patient implemented this single change and reported that his wife's response to breast touch improved dramatically. She told him, "It feels like you're being intentional now, like you're actually thinking about my experience." Such a simple adjustment. Massive impact. Tip number 3, start everywhere except the nipples. The third tip is where most men completely mess up. Don't go straight for the nipples. Start everywhere else first. The upper chest, the sides of her ribs, the soft tissue under her breasts, the curve where breast meets torso. Use your entire hand. Broad, sweeping strokes that cover area, not just fingertip pokes. Add soft kisses to her collarbone, her neck, her shoulders. Build anticipation gradually. Why? Because arousal for women is gradual, not instant. Her nervous system needs time to shift from neutral into receptive mode. Rushing to the most sensitive spot before her body is ready can feel ticklish, uncomfortable, or even irritating instead of pleasurable. A 2018 study in the Journal of Sex Research found that women who experienced at least 5 to 10 minutes of non-genital touch before genital or nipple stimulation reported 68% higher arousal levels compared to women whose partners rushed immediately to erogenous zones. 68% higher arousal just from slowing down. Think of it like turning up the volume on a stereo. You don't slam it to maximum instantly. You increase gradually until it reaches the perfect level. One patient told me he used to spend maybe 30 seconds on breast touch total before moving on. When he extended that to 5 to 10 minutes, focusing on the entire chest area first, his wife started initiating intimacy more often. She said, "I finally feel like he's savoring me, not just checking a box." Slow down. Build anticipation. Let her body catch up to the stimulation. Drop a comment if you've been rushing this step. Tip number 4, support. Don't squeeze. The fourth tip is about how you hold her breasts, not just where you touch. Most men grab or squeeze. That's not what works. Instead, support and cradle. Use your entire hand to gently lift and support the weight of her breast. Apply slow, rhythmic compressions like you're gently kneading dough, not squeezing a stress ball. Alternate compressions with moments of stillness where you simply hold her. That contrast between movement and stillness creates anticipation and intensifies sensation. Why does this work? Because firm, supportive touch communicates confidence and care. It signals that you're intentional, not fumbling. It also stimulates deeper tissue and increases blood flow without causing discomfort. Research on tactile pressure shows that moderate, consistent pressure activates pleasure receptors far more effectively than erratic squeezing or pinching. A 64-year-old patient reported that his wife had always pulled away when he grabbed her breasts. When he switched to supportive cradling, she relaxed completely into his touch. She told him, "That feels respectful, like you actually care about my pleasure." Support beats squeezing every single time. Tip number 5. The areola deserves attention. The fifth tip focuses on an area most men completely ignore, the areola. The areola is the darker, textured circle surrounding the nipple. It's packed with nerve endings and, for many women, is just as sensitive as the nipple itself. Sometimes more. Instead of rushing to the nipple, spend time on the areola. Trace slow, light circles with your fingertips. Use gentle spiraling motions that move closer to the nipple, then back away. The key is teasing. Get close, then retreat. Build tension without immediate payoff. Why does this work? Because anticipation amplifies arousal. When you delay stimulation to the most sensitive area, her nervous system becomes hyper-focused on that spot. When you finally touch it, the sensation is exponentially more intense. A study on erotic touch found that delayed stimulation to highly sensitive areas increased subjective pleasure ratings by an average of 43% compared to immediate direct stimulation. One patient told me he'd been ignoring the areola completely for 25 years of marriage. When he started spending several minutes there before touching the nipple, his wife's response changed dramatically. She said, "I didn't even know I was sensitive there. Now it's my favorite part." Don't skip the areola. It's a goldmine. Tip number 6. Treat nipples like volume controls. The 6th tip is critical. Treat her nipples like volume controls, not on-off switches. Start with the lightest possible touch. Barely there, circles with your fingertip. If she responds positively, breathing changes, soft sounds, body leaning in, gradually increase pressure. Try gentle rolling between your thumb and forefinger or soft pinching that compresses without pulling. Always increase intensity slowly and watch her cues constantly. Some women love firm pressure, others find anything more than feather-light touch painful. You cannot assume. You have to learn her body specifically. Never use sudden sharp movements. No twisting, yanking, or aggressive pinching unless she explicitly asks for it. A neuroscience study on pain and pleasure thresholds found that nipple sensitivity varies by as much as 400% between individual women. What feels amazing to one woman can be painful to another. One patient admitted he'd been too aggressive with nipple stimulation for years. His wife never said anything because she didn't want to hurt his feelings. When he finally asked what she actually liked and adjusted to lighter touch, she became far more responsive. She told him, "I was tolerating it before. Now I'm actually enjoying it. Light to firm, never aggressive." Let her responses guide you. Tip number 7. Use your mouth, but carefully. The 7th tip is about oral stimulation, which can be incredible or terrible depending on technique. If she's comfortable with it, start with warm breath across her nipples. Then use the flat of your tongue to make slow, broad licks across the areola before focusing on the nipple itself. Gentle suction feels amazing to most women. Create a seal with your lips and apply rhythmic pulsing suction, not constant hard pressure. If you want to use teeth at all, and this is critical, test on your own forearm first. Graze so lightly you can barely feel it yourself. That's the maximum pressure to use on her nipple. Anything more risks pain. Many women don't like teeth at all. Always ask first. Why is mouth stimulation so effective? Because warmth, moisture, and the unique sensation of lips and tongue activate different nerve pathways than fingers do. Combining oral and manual stimulation creates layered sensation that's more intense than either alone. A 57-year-old patient told me his wife had never enjoyed oral breast stimulation because previous partners had been too rough. When he used gentle technique, focusing on suction rather than biting, she experienced her first breast-induced orgasm at age 55. Mouth can be magical, but only with the right technique. Tip number 8. Combine breast touch with clitoral stimulation. The 8th tip is about maximizing her orgasm potential. Here's the reality. Most women, roughly 70 to 80%, cannot orgasm from penetration alone. They need direct clitoral stimulation, but here's the powerful part. When you combine skilled breast touch with consistent clitoral stimulation, her orgasms become significantly more intense. Keep one hand or your mouth on her breasts while your other hand, or a small vibrator, focuses on her clitoris. The dual stimulation activates multiple pleasure pathways simultaneously, creating a compounding effect. Research from the Journal of Sex and Marital Therapy found that women who received simultaneous breast and clitoral stimulation reported 52% more intense orgasms compared to clitoral stimulation alone. 52% more intense. One patient implemented this technique after years of focusing only on genital stimulation. His wife told him, "I've been having orgasms for 30 years, but that was completely different. It felt like it spread through my entire body." Combine stimulation for exponentially better results. Tip number 9. Don't rush away afterward. The 9th and final tip is about what happens after. Don't immediately roll away or move on to something else. Stay present. Keep your hand gently resting on her chest. Breathe with her. Let her body settle. Many women report that this decompression time is just as important as the stimulation itself. It signals care, connection, and genuine intimacy rather than transactional sex. A 66-year-old patient told me his wife used to feel used after intimacy, even though he loved her deeply. When he started staying present for several minutes afterward, holding her and breathing together, she told him, "Now I feel cherished, not just pleasured." Those extra few minutes change everything. Gentlemen, here's what you need to remember. Breast touch isn't a quick pit stop. It's an opportunity for deep connection and intense pleasure when done correctly. The 9 tips. Ask permission first. Warm your hands. Start wide before focusing on nipples. Support instead of squeezing. Give attention to the areola. Treat nipples like volume controls. Use your mouth gently, combine with clitoral stimulation, and stay present afterward. You don't need to be perfect. You need to be present, patient, and willing to learn her specific body. Every woman is different. What works for one might not work for another. The key is communication, observation, and genuine care for her experience. If this video helped you, smash that like button right now. Comment below and tell me which tip you're going to try first, and subscribe for more expert guidance on intimate techniques that actually work. I'm Dr. Livia Moret. Your age is your advantage. Maturity brings patience, and patience is exactly what creates unforgettable intimacy. Now go make her feel completely cherished.